Well, in our classes they've told us, and I didn't know this before I was moving here, but apparently Athens is one of the most impoverished parts of Georgia, or of the United States, which really shocked me. So with that, we've talked about people who don't have insurance, who don't have access to get to a hospital, and that's really been the biggest shock to me.
We think it's very important that our students have a chance to talk to real people as they explore these, larger community problems. I mean, to really understand the influences on health. I think it really makes an impression to talk to a real person and hear how they have experienced either, being well or ill, so that these future physicians can think about how that would impact, their practice in the future.
Has anything ever stopped you from getting health care when you needed it?
No.
No?
No. Yeah, money, backup. Insurance and money, that stops me from getting a lot of things.
I was talking to her, I was asking her to identify some of the healthcare problems in Athens, telling me about her experience here, how she feels about insurance, whatnot. It was good. It was pretty eye-opening. I came in here not knowing what to expect, but I suppose she didn't know as much as I expected, and some of the answers I didn't get to flesh out as much as I would have liked to. I think it's going to be good. It's something that they couldn't teach you in med school. It's only something that you're going to experience if you're actually here. It's very different to actually sit down and have a 20-minute long conversation with one of them as opposed to just reading one little sentence in a textbook describing the region of Athens.
We put a great deal of emphasis on this idea of the social determinants of health, and we know that poverty in particular influences whether we're healthy or not. From the earliest stages of our development on through, it's not only our innate biology, our genetics that we are given at birth, but it's sort of the other larger influences on our health.
If you're sensitized to problems of poverty and problems of accessing health care, when if you spend time off to go to the clinic, you lose your job. If you see that early, that stays with you. So I think the earlier you experience this, the more likely you are in your later career to have an outreach to people who are in those circumstances.